better, or at the very earliest stages, they wouldn't even know they had it. And that's where I believe it's going to work even the best. The FDA Commissioner, Stephen Hahn, who's with us, he's fantastic. And he has been working 24 hours a day. He's been, he's worked like probably as hard or harder than anybody in the group, other than maybe Mike Pence or me. And what the FDA is doing is incredible. They've done things in times that were not even thinkable. And I've directed the FDA to eliminate outdated rules and bureaucracy so this work can proceed rapidly, quickly, and I mean fast. And we have to remove every barrier. There were a lot of barriers that were unnecessary. And they've done that to get the rapid deployment of safe, effective treatments. And we think we have some good answers. We'll find out very, very soon. Clinical trials are already underway for many new therapies, and we're working on scaling these to allow many more Americans to access different drugs that have shown really good promise. We've had some really good promise. We will do so in a way that lets us continue to collect good data to know which medicines are safe and which medicines are working the best. We have a couple that we're in really good shape on, and that's for immediate delivery. Immediate, like as fast as we can get it. The FDA has also approved compassionate use for a significant number of patients. You know what that means. We're also reviewing drugs that are approved abroad or drugs approved here for other uses. And you know, one of the things that I'm most proud of that I got was right to try. That's where somebody who's ill, somebody who's very sick, terminally ill usually. In past administrations, we signed this a year and a half ago. You wouldn't be able to even think about getting any of the drugs that may be showing great promise now. And they've been trying for many decades to get this approved. And it sounds simple, but it's not, because there's liability involved and lots of other things. And I was able to get it approved working with Congress, right to try. This is beyond right to try. What we're talking about today is beyond right to try. Right to try has been, by the way, a tremendous success. People are living now that had no chance of living, where we take treatments that would, things that would have to go through years of a process. And if somebody was terminally ill, and I would say, why wouldn't they be able to try this? They'd go to Asia, they'd go to Europe, they'd go all over the world to try and find something. Or some people, if they had no money, would go home to die. They'd go home to die. They had no hope. Right to try has been an incredible success. But this is beyond right to try. If treatments known to be safe in Europe, Japan, or other nations are effective against the virus, we'll use that information to protect the health and safety of American people. Nothing will stand in our way as we pursue any avenue to find what best works against this horrible virus. Now, a drug called chloroquine, and some people would add to it hydroxychloroquine. So chloroquine or hydroxychloroquine. Now, this is a common malaria drug. It's also a drug used for strong arthritis. Somebody has pretty serious arthritis. Also uses this in a somewhat different form. But it is known as a malaria drug, and it's been around for a long time, and it's very powerful. But the nice part is it's been around for a long time. So we know that if things don't go as planned, it's not going to kill anybody. When you go with a brand new drug, you don't know that that's going to happen. You have to see, and you have to go long test. But this has been used in different forms, very powerful drug in different forms. And it's shown very encouraging, very, very encouraging early results. And we're going to be able to make that drug available almost immediately. And that's where the FDA has been so great. They've gone through the approval process. It's been approved. And they did it, they took it down from many, many months to immediate. So we're going to be able to make that drug available by prescription or states. I spoke with Governor Cuomo about it at great length last night, and he wants to be right on the. He wants to be first on the line, and so I think that's a tremendous. There's tremendous promise based on the results and other tests. There's tremendous promise, and normally the FDA would take a long time to approve something like that, and it was approved very, very quickly, and it's now approved by prescription. Individual states will handle it. They can handle it. Doctors will handle it, and I think it's going to be. I think it's going to be great. Then we're quickly studying this drug, and while we're continuing to study it, but the studying is going to be also done as it's given out to large groups of people, perhaps in New York and other places. We'll study it there. There are promising therapies produced by Gilead, and that's remdesivir, and that's a drug used for other purposes that's been out and it's had very good results for other purposes, but it seems to have a very good result having to do with this virus. And that drug also has been approved, or very close to approved in that case, by the FDA. And I can't tell you how much we appreciate what the FDA, these people are incredible patriots, and the job that Stephen Hahn is doing. Dr. Hahn was one of the most respected doctors in the country, by the way, where we took him. I said, "You sure you want to do this?" Now, we didn't know that this was going to be in the playlist, what happened here, but he really has stepped up to the plate. Wherever you are, where is he? You really have. I'd shake his hand, but I'm not supposed to do that. Get in a lot of trouble if I did that. Totally unrelated things. We believe these therapeutics and others under evaluation right now will be able to provide relief to many Americans. We really hope that's going to be. This could be a tremendous breakthrough, tremendous breakthrough. And we will work toward a much-needed vaccine in the future, as I said. And what we're doing with the FDA is so exciting in so many other fields. So many things are happening. It's a very exciting time for medicine. And we appreciate that the American public has pulled together. They're really staying home. And I think there's tremendous spirit in this country right now. It's spirit like a lot of people have not seen. People have not seen anything like it for a long time. And that means Democrat, Republican, they're pulling together. I hope everything's going good on the Hill. Maybe I shouldn't say this until I check out what's going on, because you never know. But I think there's a great spirit where the Democrats, the Republicans, and everybody else are getting together and they're trying to get things done. But most importantly, the American public has been incredible. We took the best economy we've ever had, and we said, stop, you can't work, you have to stay home. You know, there's never been a case like this. Normally, you pay a lot of money to get things going. Here's a case where we're paying a lot of money to stop things because we don't want people to be together so that this virus doesn't continue onward. So there's never been anything like this in history. There's never been, nobody's ever seen anything like this. But we're doing the right thing. We have to get rid of, I mean, our big war is it's not a financial war, it's a war, and it's a medical war. We have to win this war, it's very important. With that, I'd like to just introduce Dr. Stephen Hahn, and again, I'd like to send back with Stephen our thanks to all of the people working in the FDA who are fantastic, talented people. We appreciate it very much, everything you've done, especially the speed that you got these two elements, these two very important drugs passed. Thank you very much.
Thank you, Mr. President. I want to thank you for your leadership during this coronavirus outbreak, and thank you for the kind words about the FDA staff. We have 10,000 scientists, doctors, and others, and more than that, working around the clock to aid the American people in this fight against the coronavirus, and those words are very much appreciated, sir.
Thank you.
So before the President nominated me and I was confirmed as Commissioner of Food and Drugs, I was a cancer doctor. And I've sat across from countless number of patients and had to talk to them about their diagnosis and their treatment. And one thing that was really important is to provide hope. I have great hope for how we're going to come out of this situation. What's also important is not to provide false hope, but to provide hope. And as a doctor, that's the way I come to this. I'm speaking now to the American people as Commissioner of Food and Drugs, but that part of me has not left. Just look at the way the American people have responded to our calls for mitigation, for social distancing. The American people have great resiliency, and I'm so incredibly proud of how the American people have responded. As the President mentioned, he asked us to be aggressive, to break down barriers to innovation, and to accelerate the development of life-saving treatments. And we're doing that at the FDA. The FDA is committed to continuing to provide regulatory flexibility and guidance. But let me make one thing clear. FDA's responsibility to the American people is to ensure that products are safe and effective. And yet we are continuing to do that. Our folks and their tremendous professionals are working day and night to do this. You just can't even imagine how much they're working to provide this support for the American people, and I thank them. Since early January, long before the first domestic case, FDA began working in collaboration with CDC. I also want to note that we stood up an incident command group and have been focused on the coronavirus since the very beginning of this public health emergency. This is, in addition, an all-of-government and all-America approach, and I'll describe what I mean by that in terms of the development of therapeutics. An important part of that work is expanding the potential therapeutic options associated with coronavirus, and we've learned from our colleagues across the globe about this. But I want to focus on one thing. I was a cancer researcher before all this, and one thing I know about this great country of ours is that we have unbelievable innovators. We have people who every day, it's their job to develop treatments for all sorts of diseases. We are incredibly blessed as a country to have this. And as is true in any illness, these great American innovators, academia, private sector, they have engaged us about the best possible treatment options. We are looking at everything that's coming across our desks as possible treatment options for coronavirus. And we're extremely encouraged by the interest and the promise that we've seen from these great American innovators. Now again, we need to look at it. We need the data. We need the information to make the absolute best decisions for the American people. But I want to assure you, we have over 17,000 people at FDA who are doing this every day. We need to make sure that the sea of new treatments will get the right drug to the right patient at the right dosage at the right time. As an example, we may have the right drug, but it may not be in the appropriate dosage form right now, and that may do more harm than good. Those are the things that's our job to look at, and that's why it's really important we have these dedicated professionals looking at these aspects of therapeutic development. At the same time, we're also working through different mechanisms to actually get drugs into the hands of providers and patients. The President mentioned this, but one of the mechanisms is called compassionate use. Let me just tell you about this. If there's an experimental drug that's potentially available, a doctor could ask for that drug to be used in a patient. We have criteria for that and very speedy approval for that. The important thing about compassionate use, and that's what the President meant, this is even beyond right to try, is that we get to collect the information about that. Because one of the things, and our promise to the American people, is we will collect the data and then make the absolute right decisions based upon those data about the safety and efficacy of the treatments. We are working expeditiously, and we are working to make sure that these products are as safe and effective as they possibly can be. Let me tell you about a few things that we're currently working on. And this is a plan that was developed with many of the people at this table, our infectious disease experts on the task force. In the short term, we're looking at drugs that are already approved for other indications. So they're already approved, as the President said, for other diseases. As an example, many Americans have read studies and heard media reports about this drug chloroquine, which is an anti-malarial drug. It's already approved, as the President said, for the treatment of malaria as well as an arthritis condition. That's a drug that the President has directed us to take a closer look at as to whether an expanded use approach to that could be done to actually see if that benefits patients. And again, we want to do that in the setting of clinical trial, a large pragmatic clinical trial, to actually gather that information and answer the question that needs to be answered and asked and answered. Let me give you another example. There's a cross-agency effort about something called convalescent plasma. This is a pretty exciting area, and again, this is something that we have given assistance to other countries with as this crisis has developed. So FDA has been working for some time on this. If you've been exposed to coronavirus and you're better, you don't have the virus in your blood, we could collect, now this is a possible treatment, this is not a proven treatment, just want to emphasize, collect the blood, concentrate that, and have the ability, once it's pathogen-free, that is virus-free, be able to give that to other patients, and the immune response could potentially provide a benefit to patients. It's another thing that we're